Hello and welcome to our essential guide on stroke in seniors. Stroke is a serious medical emergency, often referred to as a brain attack, that can have devastating effects, particularly for older adults. But here's the crucial part. Recognizing the early signs and taking immediate action can significantly improve outcomes and reduce long-term disability. In this comprehensive video, we will walk you through everything you need to know, from understanding what a stroke is and why seniors are more vulnerable, to identifying those critical early warning signs. We'll cover what immediate steps to take if you suspect a stroke, explore the common causes and risk factors, discuss modern medical treatments and rehabilitation paths, and most importantly, equip you with practical prevention strategies to protect yourself and your loved ones. Our goal is to empower you with knowledge, reduce fear, and promote timely, effective responses to this critical health challenge. Your understanding and quick actions can truly make a life-changing difference. Before we dive into the specifics, let's establish a clear understanding of what a stroke is. A stroke occurs when the blood supply to part of your brain is interrupted or severely reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells begin to die. This is why a stroke is a medical emergency and why the phrase "time is brain" is so important. There are two main types of stroke. The most common, accounting for about 87% of all cases, is an ischemic stroke. This happens when a blood clot blocks an artery that supplies blood to the brain. These clots often form in arteries narrowed by atherosclerosis, a condition where plaque builds up in the arteries, making them stiff and narrow. The other type is a hemorrhagic stroke, which occurs when a blood vessel in the brain leaks or ruptures. This bleeding creates pressure on brain cells, damaging them. While less common, hemorrhagic strokes are often more severe. Seniors are particularly vulnerable to stroke for several reasons. As we age, our blood vessels naturally become stiffer and more prone to plaque buildup, increasing the risk of ischemic stroke. Additionally, many age-related health conditions, such as high blood pressure, diabetes, high cholesterol, and atrial fibrillation, an irregular heartbeat, are significant risk factors that become more prevalent with age. These conditions, if not properly managed, can significantly elevate a senior's risk of experiencing a stroke. Understanding these foundational concepts is the first step towards effective prevention and timely intervention. Recognizing the signs of a stroke immediately is paramount, as early intervention can save lives and limit disability. The acronym FAST is a simple yet powerful tool to help you remember the most common signs. F for face drooping, A for arm weakness, S for speech difficulty, and T for time to call emergency services. Let's break these down. F stands for face drooping. Ask the person to smile. Does one side of their face droop, or is it numb? Is their smile uneven? This is a key indicator. A is for arm weakness. Ask the person to raise both arms. Does one arm drift downward? Do they have trouble lifting one arm at all? The weakness might be subtle, but it's a significant symptom. S is for speech difficulty. Ask the person to repeat a simple sentence, like "the sky is blue." Do they slur their words? Is their speech strange or difficult to understand? Or do they have trouble understanding what you're saying? Any difficulty with communication warrants attention, and T is for time to call 911 or your local emergency number immediately. Don't wait to see if symptoms improve. Every minute counts in a stroke. Beyond FAST, there are other important, though less common, signs to watch for, especially in older adults. These can include sudden numbness or weakness on one side of the body, not just the face or arm. A sudden, severe headache with no known cause is another red flag, often described as the worst headache of my life. Sudden confusion, trouble seeing in one or both eyes, difficulty walking, loss of balance or coordination, or sudden dizziness can also indicate a stroke. It's crucial to remember that stroke symptoms appear suddenly and without warning. If you observe any of these signs, even if they seem to disappear, act fast. Even subtle changes in behavior, coordination, or speech that are sudden should prompt immediate medical attention. Sometimes, in older adults, these signs might be mistaken for other age-related issues, or they might not be able to articulate what's happening. Therefore, being vigilant is essential, especially if the person has known risk factors. Do not hesitate. A quick response is the best response. When you suspect someone is having a stroke, your immediate actions are critical. Remember, time is brain. The faster a person receives medical attention, the better their chances of recovery and minimizing long-term damage. The very first and most important step is to call 911 or your local emergency services immediately. Do not attempt to drive the person to the hospital yourself. Paramedics can begin providing life-saving care on the way to the hospital and can alert the hospital of an incoming stroke patient, allowing medical teams to prepare for immediate treatment. While waiting for emergency medical services to arrive, there are few things you can do, and crucially, a few things you should absolutely avoid. First, try to keep the person calm and comfortable. Loosen any tight clothing around their neck. Position them on their side if they are unconscious or vomiting, to prevent choking. Stay with them and monitor their condition. Note the time when the symptoms first appeared. This information is incredibly valuable for doctors, as certain treatments are time-sensitive. Do not give the person any medication, food, or drink. If they are having difficulty swallowing, this could cause choking. Do not try to move them unless they are in immediate danger. Let the emergency medical professionals handle their movement. Be prepared to provide paramedics with as much information as possible. The symptoms you observed, when they started, the person's medical history, current medications, and any allergies. Staying calm and providing clear, accurate information will significantly assist the emergency team. Your quick and informed response is their best chance. Understanding the causes and risk factors of stroke is fundamental to prevention. While some factors are beyond our control, many can be managed or modified. Let's categorize them. Non-modifiable risk factors include age. As we discussed, risk increases significantly after age 55 and dramatically after 65. Genetics and family history also play a role. If a close family member has had a stroke, your risk might be higher. Gender also has some influence. Women have a slightly higher lifetime risk of stroke than men, partly due to unique risk factors like pregnancy, preeclampsia, and hormonal therapy, though men tend to have strokes at a younger age. Previous stroke or transient ischemic attack, TIA, sometimes called a mini-stroke, is a strong predictor of future strokes. A TIA is a temporary blockage of blood flow to the brain, causing stroke-like symptoms that resolve within minutes or hours. It's a warning sign that should never be ignored. Now, let's focus on the modifiable risk factors, which offer significant opportunities for prevention. High blood pressure, or hypertension, is the leading modifiable risk factor for stroke. It damages blood vessels over time, making them more prone to blockages or ruptures. High cholesterol can contribute to the buildup of plaque in arteries, leading to atherosclerosis. Diabetes, if poorly controlled, can damage blood vessels throughout the body, including those in the brain. Smoking significantly increases stroke risk by damaging blood vessels, raising blood pressure, and making blood more likely to clot. Atrial fibrillation, AFib, an irregular heartbeat, is a major cause of ischemic stroke because it allows blood to pool and form clots in the heart, which can then travel to the brain. Other lifestyle factors include obesity, lack of physical activity, and an unhealthy diet high in saturated fats, trans fats, and sodium. Excessive alcohol consumption also elevates stroke risk. By understanding these factors, both those we can change and those we cannot, we can take informed steps to reduce the likelihood of stroke. Once a stroke is confirmed, immediate and appropriate medical treatment at the hospital is crucial. The type of treatment depends on whether it's an ischemic or hemorrhagic stroke and how quickly the patient arrived at the hospital. For an ischemic stroke, the primary goal is to restore blood flow to the brain as quickly as possible. The most common treatment is a clot-busting drug called tissue plasminogen activator, or TPA. This medication is given intravenously and works by dissolving the clot. However, TPA must be administered within a very narrow time window, typically within 3 to 4.5 hours of symptom onset, to be effective and safe. This again underscores the importance of acting fast. For patients with a large blood clot, especially in a major brain artery, doctors may perform a mechanical thrombectomy. This is a minimally invasive procedure where a catheter is threaded through an artery, usually in the groin, up to the brain to physically remove the clot. This procedure can be effective even up to 24 hours after symptom onset in select cases, but earlier intervention is always better. For a hemorrhagic stroke, the treatment approach is different. Since the problem is bleeding, not a clot, TPA is contraindicated. Instead, doctors focus on controlling the bleeding, reducing pressure on the brain, and managing complications. This might involve medications to lower blood pressure, reversing any blood-thinning medications the patient might be taking, or in some cases, surgery. Surgery might be needed to remove accumulated blood, repair a ruptured blood vessel, or clip an aneurysm to prevent further bleeding. After acute treatment, all stroke patients receive comprehensive hospital care. This includes close monitoring of vital signs, blood pressure management, and preventing complications like pneumonia, deep vein thrombosis, and further strokes. The hospital stay is a critical period for stabilization and laying the groundwork for rehabilitation. Knowing these advanced medical options can provide comfort. But remember, the fastest route to these treatments is calling emergency services at the first sign of a stroke. After the acute phase of a stroke, the journey towards recovery begins with rehabilitation. This phase is crucial for regaining lost functions and adapting to new ways of living. Stroke rehabilitation is a team effort involving various specialists, tailored to the individual's needs. The rehabilitation team typically includes physical therapists, occupational therapists, speech-language pathologists, neurologists, rehabilitation nurses, social workers, and psychologists. Therapists work with patients on exercises to improve mobility, walking, and the use of affected limbs. The goal is to help individuals become as independent as possible in their movement. Occupational therapy helps patients relearn daily living activities. This includes tasks like dressing, eating, bathing, and performing household chores. Occupational therapists also assess the home environment and recommend modifications or adaptive equipment to make daily life easier and safer. Speech-language pathology addresses communication and swallowing difficulties. A stroke can affect the parts of the brain that control speech, language comprehension, and the muscles used for swallowing. Therapists help patients improve their speaking, understanding, reading, and writing abilities, and provide strategies for safe swallowing to prevent choking or aspiration. Beyond these core therapies, cognitive therapy may be needed if the stroke affected memory, attention, or problem-solving skills. Psychological support is also vital, as many stroke survivors experience depression, anxiety, or emotional lability. Support groups and counseling can provide immense help during this challenging period. Family involvement is a cornerstone of successful rehabilitation. Speech-language pathology addresses communication and swallowing difficulties. A stroke can affect the parts of the brain that control speech, language comprehension, and the muscles used for swallowing. Therapists help patients improve their speaking, understanding, reading, and writing abilities, and provide strategies for safe swallowing to prevent choking or aspiration. Beyond these core therapies, cognitive therapy may be needed if the stroke affected memory, attention, or problem-solving skills. Psychological support is also vital, as many stroke survivors experience depression, anxiety, or emotional lability. Support groups and counseling can provide immense help during this challenging period. Family involvement is a cornerstone of successful rehabilitation. While immediate care is vital, the most effective strategy against stroke is prevention. Many strokes, especially in seniors, are preventable through a combination of lifestyle adjustments and medical management. Let's explore comprehensive prevention strategies. First, focus on a healthy lifestyle. This includes adopting a heart-healthy diet. Think the Mediterranean diet or the DASH diet, which emphasize fruits, vegetables, whole grains, lean proteins, and healthy fats while limiting saturated and trans fats, cholesterol, and sodium. Regular physical activity is another cornerstone. Aim for at least 30 minutes of moderate intensity aerobic activity most days of the week, as cleared by your doctor. This can be brisk walking, swimming, or cycling. Even light activity is better than none. Maintaining a healthy weight significantly reduces your risk, as obesity is a major contributor to high blood pressure, diabetes, and high cholesterol.
If you smoke, quitting is arguably the single most impactful step you can take to reduce your stroke risk. Smoking cessation can drastically lower your risk to levels comparable to non-smokers over time. Limit alcohol consumption. Excessive drinking can raise blood pressure and increase the risk of both ischemic and hemorrhagic strokes. Beyond lifestyle, meticulous medical management of chronic conditions is essential. If you have high blood pressure, work with your doctor to keep it under control through medication and lifestyle changes. Regular monitoring is key. Similarly, if you have diabetes, managing blood sugar levels is paramount. High blood sugar damages blood vessels over time. For those with high cholesterol, medication and dietary changes can help reduce LDL, bad cholesterol. If you have atrial fibrillation or AFib, which causes irregular heartbeats, taking prescribed anticoagulant medications is critical to prevent blood clots that can lead to stroke. Never stop taking these medications without consulting your doctor. Regular medical checkups are also crucial for screening, early detection, and management of any emerging risk factors. Discuss your personal risk factors with your doctor and develop a personalized prevention plan. Remember, prevention is not just about avoiding a first stroke, but also about preventing recurrent strokes if you've already had one or a TIA. Taking proactive steps today can dramatically improve your long-term brain health and quality of life. We've covered a vast amount of crucial information today, from understanding what a stroke is and why seniors are particularly at risk, to recognizing those life-saving early signs using the FAST acronym and knowing exactly what immediate steps to take. We've delved into the common causes and modifiable risk factors, explored modern medical treatments, and highlighted the importance of a comprehensive rehabilitation journey. Most importantly, we've emphasized that prevention is truly the most powerful tool we have against stroke. By managing chronic conditions, adopting healthy lifestyle choices, and maintaining regular medical checkups, you can significantly reduce your risk. Remember, the key takeaways are: know the signs, act fast, and commit to prevention. Your vigilance and proactive health management are invaluable, not only for yourself, but for your entire family. If you or a loved one are experiencing any stroke-like symptoms, do not hesitate. Call emergency services immediately. Every second counts. We hope this guide empowers you with the knowledge and confidence to protect your brain health and advocate for the best care. Thank you for joining us, and we wish you and your loved ones continued health and well-being.